Welcome back to the Deep Dive. This time, we're tackling some listener-submitted material, and let me tell you, this one hits close to home for a lot of us. We're talking root canals.
Oh, yeah, those.
But specifically, we're diving deep into the differences between single-visit and multiple-visit root canals. You know, is it really better to get it all done in one go, or is the traditional multi-appointment approach still the way to go?
You know, that's a great question, and it's one that's actually been debated in dentistry for quite a while, believe it or not.
Well, luckily for us, our listener sent in a fantastic review article to help us sort through all of this.
Absolutely. We've got this awesome review from the IOSR Journal of Dental and Medical Sciences.
And today, our mission, should we choose to accept it, is to really break down those key differences between the single and multiple visits, look at the pros and cons of each, and see what the current thinking is in the dental field. All based on, the solid research we've got in front of us.
Sounds like a plan.
So for anyone who's lucky enough to have never experienced a root canal, let's start with the basics.
Yeah, for sure.
So root canal treatment, it's basically all about saving a tooth that's got some serious problems going on inside.
Exactly. The tooth is infected.
Infected, right. So the dentist goes in, removes the soft tissue inside the tooth, which is called the dental pulp. And then they clean out those tiny little root canals. It's amazing how tiny they are, and they shape them and fill them up.
Yeah.
It's pretty incredible when you think about it, that you can actually save a tooth this way. But, thinking back, early attempts at root canals, they didn't always have the greatest success rate.
Right. I mean, dentistry has come a long way.
Oh, for sure. But now, thankfully, with all the advancements in techniques and materials, root canal treatment is actually a super reliable way to hold onto your natural teeth.
Absolutely.
I mean, the research we've got here even mentions success rates as high as like 97%. That's pretty amazing.
Yeah.
So let's dive in and tackle this single visit versus multiple visit debate.
Okay, let's do it.
What's the story behind the traditional, multiple visit endodontics?
Well, like you were saying, for a very long time, multiple visits, that was the standard. Like, that's how root canals were done.
It was just the way it was done.
Exactly. And, it wasn't just out of tradition. I mean, there were reasons for it. Partly it was because those older techniques, they took more time to perform properly.
Yeah. Like more steps involved, things like that.
Yeah. It was a bit more complex, I guess you could say.
Yeah.
And then also there was this strong belief, and, some dentists still hold on to this, that spreading the treatment out over several appointments, that just gave you a better chance of success and that it was the safest option for the patient.
Interesting. So it wasn't just about the procedure itself. It was about like a philosophy of care almost.
You could say that. Yeah, I think so. It was a philosophy of, let's be thorough, let's take our time.
So if we break it down, what's the logic behind splitting it into multiple appointments? What are they actually trying to accomplish by doing that?
Okay, so the main goal, right, is to really go after those nasty bacteria that are causing the infection down there in the root canal system.
Right, the whole reason you're doing the root canal in the first place.
Exactly. So when the dentist goes in and cleans those canals, with those special instruments and all, and then rinses them with antibacterial solutions, sodium hypochlorite is a common one.
Sodium hypochlorite, yeah.
That mechanical cleaning, just by doing that, the research actually shows they can get rid of a lot of the bacteria. Like we're talking 40 to 60%.
That's pretty good.
It is. But, as you can imagine, it's not 100%.
Yeah, it's not perfect.
So that's where the multiple visits come in.
Okay. So then what happens in those follow-up appointments? Like, what are they doing then?
Well, that's when the dentist brings in the big guns, what we call intracanal medicaments.
Intracanal medicaments, okay.
Yeah. So it's basically like medication that goes right inside the canal.
To kill more of those bacteria?
Exactly.
Yeah.
And the gold standard for this, like what everyone's using these days, is calcium hydroxide.
Okay, so it's like a paste, right?
It is, yeah, it's a paste. They put that inside the canals as a dressing.
Make a little bandage for your tooth?
Exactly. And they leave it there for about a week between appointments.
Oh, wow.
And this does a really good job. It can bump up that bacteria kill rate to around 70%.
Wow. So it's like a slow release antibacterial thing working away in there between visits.
It is, yeah, that's exactly what it is. And the idea is that by giving it this extra time, this extra week with that antibacterial agent in there, you're really making sure that canal system is as clean as it can possibly be.
Okay, I get it. So calcium hydroxide, that's the magic bullet.
Well, it's pretty close.
Yeah.
But, the article we've got here, it does mention that even calcium hydroxide has its limitations.
Bummer. So what are those?
Well, it works great against a lot of the common types of bacteria that you find in infected root canals, but it's not effective against everything.
Oh, no.
Yeah, there are some tougher guys out there. Candide albicans, for example.
Is that a fungus?
It is. Yeah, it's a type of yeast that can sometimes be involved.
Okay.
And then there's Enterococcus faecalis. That's a bacteria.
That sounds tough.
It can be, yeah. They're both known for being a bit resistant to calcium hydroxide. So, researchers have actually been looking at ways to beef up that calcium hydroxide, like adding different substances to it to try and make it even more effective against these tougher types of bacteria.
Interesting. So it's like a constant arms race against the bacteria?
It kind of is.
Okay, so we've got this biological advantage of the multiple visits, right, with that extended exposure to the antibacterial dressing, hopefully getting rid of most of the bad guys.
Right.
But are there any cases where multiple visits are just like absolutely the way to go, no question?
Yeah, absolutely. So the review points out that if someone comes in and they're in a lot of pain, like serious pain, and maybe there's even swelling around the tooth, it's probably best to just focus on getting them out of pain at that first appointment. Make them comfortable.
Totally.
So you do what you need to do to relieve the pain, and then the actual filling of the root canals, what we call obturation, you do that later at a follow-up appointment once things have calmed down a bit.
It just makes sense. Like, you wouldn't want to put someone through a long procedure when they're already in agony.
Right. Exactly.
But let's be honest, stretching the treatment out over multiple appointments, it has to have some downsides, right?
Yeah, for sure.
I imagine there could be a few, logistical headaches with that approach.
Oh, there definitely can be. And the article lists a bunch of them.
Let's hear it.
One of the biggest concerns is that, between appointments, there's always that risk of recontamination.
Right.
So you put in that temporary filling to seal things up.
Temporary filling, yeah.
But if that cracks or leaks, well, guess what? Bacteria can sneak back in.
Oh, that's not good.
And that can lead to, you guessed it, a flare-up.
Ugh, the dreaded flare-up.
Exactly. And no one wants that, right? More pain, more swelling.
Back to square one.
Yeah, pretty much.
Yeah.
And then there's just the fact that multiple appointments, well, that's just more time. More time out of your day, more trips to the dentist.
I mean, who really wants to spend that much time at the dentist?
Yeah, it can be a drag. And the dentists, they get tired too.
Oh, yeah, I bet. Long procedures, all that focus.
Exactly. And then there's specific situations where it can be a real issue. Like if someone has a front tooth that's been injured and they need a root canal.
Right.
Well, multiple visits mean it takes longer to get that permanent restoration in place. The one that looks nice and matches their other teeth.
I see.
And that can be tough for people, especially if it's affecting their smile and their confidence.
Totally.
And then, let's be real. There are some patients who start treatment and then just don't finish it.
Oh, yeah. For whatever reason, life gets in the way.
Exactly. And that can lead to the whole root canal failing.
Because it's not finished.
Exactly.
So, okay, multiple visits have their place. We get that. But they definitely have their own set of potential issues.
For sure.
So let's shift gears. Let's talk about this single visit endodontics. I mean, it sounds like this isn't just some trendy new thing, right?
That's right. It's got a surprisingly long history.
Really?
Yeah, believe it or not, the idea actually goes all the way back to the 1880s.
Wow.
Yeah, I know, right? But back then, the techniques they used were pretty basic.
Like really basic.
Very basic. And, well, the success rates weren't that great.
I can imagine.
So it kind of fell out of favor for a while.
Makes sense.
But then it had this revival in the 1950s.
Oh, okay.
Yeah, a dentist named Ferranti. He started using it again.
Okay.
But his methods, they were still pretty different from what we do today.
Gotcha.
He was using things like diathermy, which is basically a heat treatment to kill the bacteria.
Oh, okay.
And hydrogen peroxide for cleaning, stuff like that. But it was definitely a step in the right direction.
So it took some time for single-visit endodontics to catch up with modern dentistry. What were some of the big breakthroughs that really helped to bring it, into the mainstream?
Well, the article mentions this study from 1970 by a dentist named Tosti.
Okay.
And his results with single-visit treatment, they were pretty promising. But it was a small study.
Gotcha.
But then there was this dentist named Olliott. And he had this really key idea that kind of changed the game.
Okay. What was that?
His thinking was basically that all the things you need for a successful root canal, whether it's single visit or multiple visits, they're all the same.
Oh, interesting.
So you need the right diagnosis, you need to choose the right cases for single visit, and you need to use good modern techniques.
Yeah.
And if you have all of that, then it doesn't really matter if you do it in one visit or several.
So the approach doesn't matter as much as doing it right.
Exactly.
I see. So when is it a good idea to do a root canal in a single visit these days?
There are actually quite a few situations where it's a good option.
Yeah.
It's often a good choice for teeth that are still alive, what we call vital teeth, and haven't had any complications.
Okay, vital teeth.
Yeah, so those are uncomplicated cases. And it's also often used for cases where the pulp has been exposed because of decay or injury,
Okay.
and it's gotten inflamed. That's called symptomatic pulpitis.
Symptomatic pulpitis, okay.
Yeah. And then single visit can also be really helpful for people who have physical challenges that make it hard for them to come in for multiple appointments.
Makes sense.
And also for people who are super anxious about dental work, maybe they need sedation.
I can relate to that.
Yeah, me too.
So it's better to get it all over with in one go.
Absolutely. And then there's some other cases, like if someone has a fractured front tooth and the pulp's involved, but there's no infection around the root.
No infection.
Right. Or if it's a recent injury where you want to get a good-looking permanent fix in place as soon as possible, single visit can be a great option. And interestingly, it can also be used for non-vital teeth.
So teeth that are already dead?
Yeah, but specifically those that have a sinus tract.
What's a sinus tract?
So it's basically a little channel that allows the infection to drain out.
Oh, interesting.
And in those cases, the risk of a flare-up after treatment is usually lower. So single visit can be a good option.
So those are all situations where getting it done in one shot would be a real advantage. Fewer appointments, less stress, faster results.
Exactly.
But I imagine there are some cases where single visit just isn't the best way to go.
Absolutely. There are definitely some red flags, like if the tooth is non-vital and it's acutely inflamed, like really painful and swollen, that's usually better handled over multiple visits. And then teeth where there's a lot of fluid leaking from the canals, we call those weeping canals.
Weeping canals, that sounds pleasant.
Yeah, not so much. Those are usually better treated with multiple visits too. And then there are the tricky cases where the root canals are really narrow or curved.
Yeah, hard to reach.
Right, they're hard to reach. Those can be a challenge for single visit. And same goes for teeth that are just generally difficult to access.
Okay.
And then non-vital teeth that are causing symptoms, but they don't have a sinus tract.
Okay.
Those usually need multiple visits too. And most of the time, if someone's had a root canal before and they need a retreatment, that's also usually done over multiple visits.
Okay, makes sense. So it really comes down to choosing the right cases.
Exactly. It's not for everyone.
All right, so let's say we've got a good candidate for single visit. What are the advantages besides just convenience? I mean, what are the real benefits?
Well, yeah, the convenience factor, that's a big one for a lot of people.
Fewer trips to the dentist, less time in the chair.
Exactly. But there's some real clinical advantages too. So think about patients who have certain medical conditions, maybe heart conditions, where they need to take antibiotics before dental procedures.
To prevent infection.
Right, to prevent infection. Well, if you could do the whole root canal in one visit, that means they only need one round of antibiotics.
Oh, that's a good point.
Yeah, it reduces their exposure to antibiotics, which can be a good thing. And it also just makes things more efficient.
Oh, so?
Well, it's more efficient for the dentist, in terms of their time, and they use fewer materials overall.
Okay.
And then this one's kind of interesting. The review actually mentions that it can even lower the chances of legal issues.
Legal issues, really?
Yeah, because there's less risk of cross-contamination between visits.
Oh, I see.
And then, of course, there are the benefits for the patient, like less discomfort overall, less anxiety, and lower risk of any complications from having local anesthesia multiple times.
That all makes sense.
And there's also a smaller chance of the dentist making a mistake during the procedure.
Because they're less fatigued.
Exactly. Long procedures can be tiring. And then probably the biggest advantage of all, at least from my point of view, is that you eliminate the need for that temporary filling.
Oh, yeah. No risk of bacteria sneaking in between visits.
Exactly.
So there's a lot to be said for single visit. But what about the downsides, like from the dentist's perspective?
Well, the review does mention a few. So first off, doing the whole thing in one go, it can be pretty demanding.
Yeah, I bet.
It can put pressure on both the dentist and the patient, especially if it's a complex case.
Right, those tricky canals.
Exactly. And then if there's a flare-up after the tooth has already been filled,
oh, right,
it might be harder to manage because, with multiple visits, the canal's still open. It's not filled yet.
So you can get to it easier?
Right. But if it's already filled, well...
You've got to go back in.
Yeah.
So it's like weighing the risks and benefits, right?
Exactly.
Okay, so now let's get to the juicy stuff. This review spends a good chunk of time debunking what it calls myths about single-visit endodontics.
Yeah, the myth-busting section. It's a good one.
What are some of these common misconceptions that might be preventing single visit from being more widely accepted?
Well, one of the biggest ones, and this is one that I hear all the time, is that people have more pain after a single visit root canal.
Yeah.
Especially if the tooth was already dead, non-vital.
Non-vital.
Like,
Yeah, exactly.
it just makes sense, right? You're doing more work in one go, so it must be more painful.
Yeah, it's kind of intuitive.
It is, but the research actually tells a different story.
Oh, really?
Yeah, most of the evidence shows that there's actually no big difference in pain levels after single versus multiple visits.
Wow.
And it doesn't seem to matter whether the tooth was vital or non-vital.
So it's a myth.
It is, yeah, it's a myth. But, science is complicated, right? So there are some studies that have found different results.
Okay.
The review mentions a study by Wang and colleagues that found no difference. But then there's one by Riso and colleagues where they actually found more pain with multiple visits.
More pain with multiple visits.
Yeah, I know. Kind of goes against what you'd think, right? And then there's one by Ogini that found more pain with single visits.
So it's a mixed bag.
It is, but the takeaway, the main point, is that the majority of the evidence points to similar pain levels, whether you do it in one visit or two.
So don't let fear of pain stop you from considering single visit.
Exactly.
Okay, so what's the next myth on the chopping block?
All right, so this one's about healing. People worry that teeth treated in a single visit, especially those non-vital teeth with infection around the root,
Yeah.
they worry that those teeth just don't heal as well in the long run compared to teeth that were treated over multiple visits.
I see.
But again, the research doesn't really back that up.
Okay, good.
So when we're talking about healing in endodontics, we're usually looking at healing after at least a year.
To see if the infection's really gone.
Exactly. And based on the studies that have looked at this, there just isn't a big difference in healing rates between single and multiple visit treatments.
It's good to know.
Yeah, it is. And the review even mentions this meta-analysis.
A meta-analysis, that's like a study of studies, right?
Exactly. So they looked at a bunch of different studies, and they actually found a slightly higher healing rate with single visit treatment.
Higher with single visit.
Yeah, about 6.3% higher.
Interesting.
Isn't that interesting?
Yeah.
And then there was another study by Perez Vieira that also found no significant difference in healing.
So basically the idea that single visits lead to worse healing, that's just not true.
It's not. It's a myth.
Myth busted. Okay, what about flare-ups? Everyone's terrified of those.
Yeah, they're no fun. But good news, the research doesn't show that they're more common with single visits.
Really?
Yeah, there was a study by Akbar and colleagues. They looked at flare-up rates, and they found no significant difference between the single visit and multiple visit groups.
So one less thing to worry about.
Exactly.
Okay, what else do we have?
All right, so the next myth has to do with those antibacterial medications that we were talking about earlier.
The calcium hydroxide.
Right, calcium hydroxide.
Okay.
So the misconception is that if you put that medication in the tooth between visits, you're guaranteed that the canals are going to be completely sterile.
Like it's a magic potion.
Yeah, like it's going to kill everything. But unfortunately, it's not that simple.
I figured.
Yeah. So there's actually a lot of debate about how effective calcium hydroxide really is.
Oh, interesting.
Some studies have shown that it does lead to better outcomes compared to just leaving the canals empty between visits.
Okay.
But like we were saying before, it doesn't kill all types of bacteria.
Right, those tough ones.
Exactly. So the current thinking is that it's a good addition to the cleaning process, along with those antibacterial rinses, but it's not a guarantee that everything's going to be completely sterile.
I see.
And the review also points out that even if you do use calcium hydroxide, if that temporary filling leaks,
Oh, yeah, that's a big problem.
you can get new bacteria coming in and ruining all your hard work.
Right.
And there was this interesting study by Gessie and colleagues. They found that if the dentist does a really good job with the initial cleaning, shaping, and filling of the canal,
Okay.
then using calcium hydroxide between visits might not even make a big difference in the end.
Well, it's more about the skill of the dentist than anything else.
It seems that way.
That's good to know. Okay, what's the next myth we need to bust?
All right, so this one is a bit more philosophical.
Yeah.
It's the idea that multiple visits are just inherently safer for the patient.
Oh, yeah. Like it's more careful, more thorough.
Exactly. But that's not always true.
Okay, tell me more.
So there are certain patients who are at risk of bacterial endocarditis. That's a serious heart infection.
Okay.
And for those patients, the guidelines actually recommend that you do as much dental work as possible in one go. under a single course of antibiotics.
Oh, I see.
So for those patients, a single visit root canal is actually safer because they don't need multiple rounds of antibiotics.
Less exposure.
Exactly.
Yeah.
Which means less risk of side effects and antibiotic resistance.
That's a really good point.
Yeah, it is. And even for patients who aren't at risk of endocarditis, single visits mean they're exposed to less medication overall.
Fewer pain relievers, fewer antibiotics.
Exactly. And less local anesthetic too.
So fewer chances of having a bad reaction to something.
Exactly.
Okay, this is really making me think differently about single visit endodontics.
It is interesting, isn't it?
What about patient preferences? Like, do patients actually prefer multiple visits?
That's another myth. Myth number 6, to be exact.
Okay, so what's the truth about that?
Well, besides the cost, the two biggest things that keep people away from the dentist are fear and time.
Yeah, I can relate to that.
Right.
Who likes going to the dentist?
No one. So single visit root canals, they address both of those things. You're only anxious once, and you spend less time overall at the dentist.
I see.
So a lot of patients actually find the single visit approach more acceptable.
Okay, I get it.
Makes sense, right?
Totally. All right, so the last myth we need to address is about those post-treatment flare-ups.
Oh, yeah. So the worry is that if a flare-up happens after a single visit root canal, it's going to be harder to deal with.
Because the tooth is already sealed.
Exactly. But guess what? Research shows that flare-ups after the tooth has been filled are actually less common than flare-ups that happen between appointments.
Really?
Yeah. And most of the time, they can be managed with simple things like adjusting the bite, pain meds, maybe antibiotics.
Okay.
And in rare cases, you might need to do a little procedure to relieve the pressure.
Okay.
But the important thing is that if the canals were cleaned and filled properly in the first place, it doesn't really matter if it was done in one visit or multiple visits.
So the initial treatment matters most.
Exactly.
Wow, we've busted a lot of myths today.
We have. It's been a myth-busting extravaganza.
So after looking at all this research, what's the big takeaway message?
Well, the review basically concludes that if single and multiple visit root canals have similar outcomes, in terms of pain and healing,
Yeah,
then single visit treatment is probably the better option for most patients.
because it's more efficient, more convenient.
Exactly. Less hassle all around.
So for a listener who sent in this awesome material, it seems like the evidence is really pointing towards single visit as a great option.
It is. And, it's really come a long way since those early days.
It's pretty amazing how far dentistry has come.
Yeah, it is. And I think that's one of the big takeaways from this whole discussion is that dentistry is constantly evolving. There's always new research coming out, new techniques, new materials.
So we need to stay informed.
Absolutely.
So as you, our listener, process all of this, I think it really begs the question, how does all of this new information affect your own views on dental care?
Right.
And what other questions do you have about how dental treatments are changing?
Yeah, it's really exciting to think about all the advancements that are happening.
So keep those questions coming, keep learning, and most importantly, keep taking care of those teeth.
And don't be afraid to ask your dentist about single visit treatment if you think you might be a good candidate.
Great advice. Thanks for joining us on this deep dive, everyone. Until next time, stay curious.
Bye.